We are on live, so we are good to go now, sir.
Hello, good afternoon, doctors. Welcome to this program on experience sharing program on managing PPH, case studies from labor room. This program is brought to you by Hetero Healthcare, an innovative pharmaceutical company. Hetero Healthcare, the journey began in 1993. We have got 25 years of excellence, 36 state-of-art manufacturing facilities, and 300 plus products in portfolio. Hetero Healthcare has presence in 126 plus countries, 21,000 employees globally, and is the largest closely held pharmaceutical company in India. Hetero Healthcare is among the largest manufacturers of ARV, APIs, and FDFs in the world, and is Asia's largest API manufacturing facility at Visakhapatnam, Andhra Pradesh. Hetero Healthcare is 360 degrees solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties, pioneering in quality and innovation, and Hetero Healthcare has distinction of bringing 4 biosimilar products to market within 5 years of initiation. During COVID-19 pandemic era, Hetero Healthcare, the pioneers in antivirals, offered oseltamivir, favipiravir, and remdesivir to the patient, because of which, in August 2020, Hetero Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar, Experience Sharing Program and Managing PPH, we have got Honorable Speaker, Dr. Mehak Parashar with us. Welcome, Dr. Mehak. Dr. Mehak Parashar is MBBS from GMC Patiala, MBBS in Obstetrics and Gynec from GMC Amritsar. Madam has done fellowship in minimum invasive surgery. Areas of interest include infertility, high-risk obstetrics, and Madam is private consultant at Parashar Nursing Home, Hisar, since 2018. Once again, a warm welcome, Dr. Mehak, and over to you.
Thank you. Thank you. Good evening, everyone. How to? As we all know, postpartum hemorrhage is loss of at least 500 ml or more blood during delivery. Uh, as for limit, for normal delivery, we take it as more than 500 ml. For cesarean, it can be between 500 ml to 1 liter. There are mainly four main causes which we all know. First one is most common is tone, which is atonic uterus. Next is thrombin, which means the coagulation factors are deranged. Then trauma. Trauma is more common during normal delivery, like cervical lacerations, vaginal lacerations. It can be during cesarean also, like broad ligament hematoma or any rectus muscle hematoma. And last one is tissue, which can be due to retention of placental bits. So these are the most four common causes of PPH. Most common one being the tone, atonic uterus. There are some risk factors for the atonic PPH, we all know, which can be anemia and multiple pregnancies, history of prolonged labor, and a history of PPH in previous pregnancy is also a risk factor for this. And active management of third stage of labor, we consider it was improvised by WHO for prevention of atonic PPH. In this, we should inject the uterotonic agent with as soon as the baby is delivered. Earlier, it used to be with the delivery of anterior shoulder, but now it is preferred like as soon as the baby is delivered. And initially, we used to inject uh, oxytocin 10 units intramuscular or 20 units intravenous. But now, since we have we have got the carbetocin, it is much better than oxytocin because it's heat stable and it's much more effective. Action is also quite quick. So, in my practice, I use carbetocin for every cesarean patient and for all those normal deliveries who have a pre-existing risk factor for PPH, atonic PPH. And actually, it has saved a lot of patients from PPH. And in the long run, it helps, in prevention of anemia in patients, prevention of unnecessary blood transfusions, which we have to give if patient goes into PPH. Carbetocin has actually revolutionized the we can say active management of third stage of labor. my opinion. How to diagnose PPH? It's like uh, patient vital will deteriorate, abdominal tenderness, fundal height will increase, and there will be tachycardia and there will be visible bleeding. So this uh, shows us how to. We all know how to diagnose PPH, and most first sign to appear in PPH is tachycardia. Before the BP drops, the pulse start rising. So you have to be very careful about the pulse. Approach towards PPH is prevention is like we should identify which cases are prone to get postpartum hemorrhage. In them, we need to take extra care. So if we'll be bit conscious about who are more prone to get PPH, we'll be more easily able to prevent the PPH in patients. PPH is still the leading cause of maternal death in our country. So preventing postpartum hemorrhage is very, very important for maternal health. Carbetocin is better than oxytocin because it's heat stable. So during transport, it won't lose its potency. That is the biggest advantage, and it has shorter half life. So action is quite quicker and it's more sustained. It's more sustained. Use of uterotonic agent, we should be which is also as suggested by WHO, active management of third stage of labor. It should be immediately after the delivery of the baby, not at the delivery of anterior shoulder. Now it's immediately after the delivery of the baby. Prophylactic use is for prevention of PPH, and therapeutic is if there is PPH. So molecules include oxytocin, carbetocin, ergometrin, and mesoprost. Carbetocin has a longer duration of action as compared to oxytocin, and long acting, basically it's long acting, heat stable analog of oxytocin. This shows the benefit of carbetocin over oxytocin. I've already told you, you can see the half life of oxytocin is 1 to 6 minutes, while carbetocin has half life over 40 minutes, and it can be stored for conditions up to 30 degrees Celsius. So it's much, much, much better than oxytocin in preventing PPH. This is the champion trial. Carbetocin, which shows carbetocin is equally or better than oxytocin.
Should I go to the next, madam?
Yes, sir, yes. Please, not so significant. This is Cochrane review. For women who undergo cesarean section, carbetocin resulted in statistically significant. This I've seen in my experience also. So we are using it for every cesarean patient, and yes, it has definitely reduced the incidence of blood transfusion in post cesarean patients. It's quite helpful. So I would suggest we should use it as a regular nutrotonic agent instead of oxytocin. I would suggest everyone to use it as a regular oxytocin agent in place of oxytocin. It's much better. Guidelines like WHO, SOGC, everyone recommends carbetocin as the first line agent in prevention and management of PPH. My experience already told, it's much
Since
better
how
than
long you are
oxytocin.
using, madam?
It has been, I think, 1.5 to 2 years. I exactly don't know. Since it was launched,
Okay,
I don't know. It was launched 3 years back. I exactly don't remember.
no problem.
But yes, we are using it in every cesarean patient. Earlier we had to use carboprost, mesoprost. Now we don't need all those also. Like in twin delivery, in anemic patients, multiparas, we had to use carboprost or mesoprost in addition to oxytocin. They used to go in atonic PPH on table or after cesarean, but touch wood, I would I would say touch wood after using carbetocin, it's quite better. We rarely use
Yes,
other
carbetocin
agents.
is carbetocin is recommended for prophylaxis of PPH.
Yes, we are using it as prophylaxis
Prophylaxis.
routinely every cesarean, and in normal delivery, those who have the high risk for PPH in them. And if there is PPH, then as
Of course,
therapeutic
that's a different
use.
story.
Yes, yes.
I will come to some of the questions. What is the benefit of using carbetocin as first line? You have already said this.
Yes. Side effects are very less. Like
Very
with
less.
carbocost, if we use, there's so vomiting and lot of pain. It
Yes.
has negligible side effects.
And
So,
madam,
so it is.
suppose you give carbetocin
Yes,
in your patient for prophylaxis of PPH.
yes, yes.
Uh, do you think it should be given to every patient or only to cesarean section patients or only to high risk patients? Or it should be given as a first line to every patient?
It should be given like for cesarean. I'm giving for every cesarean.
Every
Normal
delivery.
delivery we can give. It's bit of a cost factor, so I try that.
Correct.
Yes,
Yeah, cost is
that
a factor. Cost is a factor.
yes,
Correct.
cost is a factor. That's why for normal delivery we give it for high risk, but for every we give it for every cesarean
Every.
patient.
Correct. And who are the patients who are likely to get a PPH? Madam, is
Uh,
anemia is a high risk in our country for
yes,
PPH?
yes, anemia because tissue tone is poor.
Very
So uterus finds a problem in contracting. Anemia, twin delivery, PIH, pregnancy-induced hypertension, prolonged labor. Those who have obstructed labor, prolonged labor, they are quite common. They all are a high risk factor, and there are patients who had PPH in previous delivery. They are also a risk factor
absolutely.
to have PPH in next delivery also.
And many times patients do not come out clearly with their past obstetric history.
No, they don't come.
Yes. And many times people don't realize it was PPH. They just feel it was bleeding after the delivery.
Yes, yes,
Yes.
they don't even realize the gravity of
Yes.
the
Yes.
situation that what they
In
had.
Mumbai, in
Yes,
the peripheries of Mumbai, we have seen hemoglobin as low as 5 and 6.
yes, yes, it's quite common. It's quite
Yeah.
common there.
And that is
Like,
one of the
yes,
most common cause in our country, I
yes,
think.
that is, and it's so life-threatening. Anemic patient
Yeah, yeah,
getting
yeah. A
PPH,
little loss
it's
of blood can also affect the
yes,
hemodynamic parameter.
yes, yes,
Any experience in using in RH negative mothers, madam?
yes. We give it for every RH negative for cesarean
No
patient. We are
problem.
giving it. No problem
And
in that.
anyways, we'll give anti-D, etc. So
Yes,
this,
yes, that we are giving it, but carbetocin has no
no problem.
contraindication for RH negative.
Generally, we use oxytocin for induction. Can we
Yes,
use carbetocin for prevention?
yes,
Yes,
we
of
can.
course.
Of course,
Yeah.
that's not an issue.
You generally prefer what route, madam? IV or IM?
IV route in cesarean, IM route in normal delivery.
Sorry? IM?
IV route, IM in normal delivery.
In normal, okay. In IM, you'll use in normal delivery, whereas
Yes.
IV you'll use in cesarean section.
Cesarean,
That's
cesarean. Just
wonderful.
we quickly
Where
give it
we,
as soon as the baby
yes,
is delivered. Anesthetist gives it.
yes. So we already, I mean, we have got a setup where anesthetist can monitor, give IV,
Yes, 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 yes.
whereas
There.
whereas you can concentrate on the
In
delivery.
normal delivery, I give it
Yes.
IV.
I mean, giving an advantage is I mean, IM is a great advantage in the periphery where you may not have facilities all the time
Yes,
with
yes,
IV,
yes.
with the
It's
paramedicals help.
equally good. I mean, I've used it as I am. It's good. No issues
Yes.
in my
Especially although the action onset may be slightly delayed as compared to IV, the
slightly, not
duration is
much.
longer. Yes.
Yes, yes.
Yes. And how is your experience? How the will it is tolerated? Like prostaglandins, many of them can give adverse effects.
Many of them.
Yeah.
So far, so good. I have not
Thank God.
encountered. Thank God, touch wood. Yes,
In drug तो नहीं side effect देना चाहिए. PPH itself is a complicated condition.
yes, yes, yes. No, till now, thankfully, I have not seen any adverse
Thank God.
effects.
Thank God. Yeah.
Yes, thank God.
Suppose if the patient doesn't respond adequately with carbetocin देने के बाद में भी patient को PPH हो
Hmm.
गया, then of course is the active management of treatment of PPH.
Yes, yes, yes.
And you generally
Uh,
prefer medical management or you straight away go to surgical?
no, medical management. Medical
Medical
management.
management. Like,
Most of them respond with
yes.
mesoprost. I
Yeah.
give sublingual mesoprost is very
Correct.
good if we give no sublingual mesoprost, carboprost.
Correct.
Eh, most of the patients respond with all these. If even after carbetocin, if
Correct.
we give two more agents, they will respond.
And sometimes if the patient can tolerate, if the patient is okay, even methergine can be used.
Yes, yes, yes. Detergent. We do use
Yeah.
detergent sometimes.
Advantage of carbetocin apart from single use and I mean storage conditions is also important.
A longer action,
Yes.
less side effects, better tolerability, quite effective.
Madam, how commonly you have seen secondary PPH after giving carbetocin?
I don't think I've seen. I don't think
Or may not be
I've seen.
secondary, maybe 7, 8 hours later. I mean, not technically secondary, but a little later. Have you seen these things?
No,
No, no.
no.
So that shows the longer duration of action.
Yes, yes, definitely.
Should it be kept as a reserve drug cost apart, huh? Or it should be used as a first line?
No, it should be used as a first line.
First line. Yeah, looking at
Yes.
all the benefits. क्यों रुकने का
Yes.
ना? Yeah.
Ah.
And what is at stake? Life may be at stake. Sometimes the things may slip
Yes.
from our hands so fast. We
No,
cannot
no,
do it.
no. It should be used as a first line.
And now coming to the last, what is your overall experience, take home message for the audience?
I would say everyone should use it as a first line. Even
First line.
bit costly, not that much. But if you see, if you give oxytocin, then you give methergin, then you give carboprost, then you give MCET,
Yeah, cost तो
it'll
वही आती है. And
yeah,
finally,
it'll cost.
cost of PPH itself is very high.
Yes, 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 yes. It's not so costly. So everybody should use it as a first line. It is
Correct.
actually a very good molecule, very good
Correct.
drug.
Correct. 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 Madam, thanks for sharing your experience, madam, with the doctors. I'm sure the participants have benefited out of it. क्या होता है ना, although there are many articles, our own doctor's experience is more important to them. Thank you
Yes.
so much for taking time and sharing your
Thank
experience.
you, thank you.
Thanks all the doctors who took time and attended this webinar. Thank you, marketing and sales team of Wipro. Thanks, Tanvi. Thanks, Bhuvan. And thanks all the sales people who coordinated. Thanks so much, madam.
Thank you,
Wish you a very
everyone.
good
Thank you.
afternoon. You can sign off, madam.
Thank
Thank
you.
you.
Okay.
Thanks, Bhuvan.